Hello, my name is Kaylee McReynolds. I'm an MSW candidate out of University of Washington, Tacoma. Just a little bit about me. I began my journey as a social worker student in 2019 with a particular passion to advocate for the lack of resources available for vulnerable older adults, including adults with developmental disabilities. I've advocated for this population in most of my assignments throughout my social work education, and I plan to continue to advocate for disadvantaged groups as I continue my career in social work. But I've recently turned my focus on the abandonment of this group to the emergency departments, developed at the later end of my MSW journey through my advanced practicum. As a student, I've had the privilege of working with vulnerable older adults in the emergency department of Allen Moore Hospital in Tacoma. I have shadowed many social workers who've had patients that have been abandoned to the emergency department, and was even able to make my own connections with these patients, and they have made an impact on who I am as a social worker today through conversations of joy and conversations of their family, and then also conversations of sadness and shock that will forever be engraved in my mind when telling patients that their loved one who cared for them and brought them here did not want to receive calls about their health and was not ultimately going to pick them up from the hospital once they were medically cleared. So it comes to a shock to the patients, but for social workers, doctors, nurses, care managers, the medical staff, this is a very familiar circumstance that we commonly see, unfortunately. So some of these patients even suffer long hospital stays because of placement complications. COVID-19 was not a friend of placement, and like I mentioned, intentional disconnect from family members, primary family members that were needed. So a few patients lost their will to live, succumbed to the loss of mobility, loss of appetite, pneumonia. These circumstances happen. So witnessing family members dropping off their older fathers, mothers, grandparents was heartbreaking to watch, and motivated me to examine the barriers and the risk factors that exist to create societal gaps, allowing this to even be an ultimatum for caregivers. Older abuse and the granny dumping phenomenon for older adults is a public health issue that will grow as the population ages. We must acknowledge that this is an issue that some of us will face in our life and begin to build a protection net for our older adults as valuable citizens to society instead of a burden. So this is my project, Caring for Caregivers, to decrease older adult abuse with an emphasis on abandonment to the emergency departments. This program targets caregiver burnout as a key risk factor. Caring for caregivers helps families through the process of caring for vulnerable older adults by providing research-based trainings and education. This program draws attention to the importance of family stability, older adult empowerment, self-care, and disability rights. The implementation of this information to caregiving roles is vital to decrease older adult abuse and specifically target abandonment to the emergency departments through targeting caregiver burnout. I think this is an important program for our community because, like I've mentioned, the average life expectancy for humans is consistently increasing each year, meaning a larger population is going to experience older adult abuse. More and more hospitals will experience lack of hospital beds due to the granny dumping phenomenon, and more older adults will experience long hospital stays due to lack of resources based off of many things like income, insurance, mobility, mental health, acuity, disabilities. So more and more caregivers will experience burnout, having less training and education necessary to adequately care for vulnerable older adults. So by using the supporting theories that I've laid out on the poster, Theories of Human Behavior, this program begins by looking at the family as a unit, as a whole, with an intricate system and an already formed foundation. One theory I felt was important to draw from to normalize family challenges was intergenerational family systems approach. Each level, micro through macro, influences each behavior and thought process, creating environments specific to those behaviors and thought processes. And the acknowledgement of this connection is vital to growing safe and kind environments necessary for caregiving. Also, family systems therapy through Bowen's theory highlights that changes in behaviors of family members impact each member individually, which is why the program highlights a safe and kind care throughout the trainings and education modules. Stakeholder interviews that I've held that include caregivers, medical staff, show that there's a drastic need for the creation of safe environments as a foundation, as one of the initial building blocks to a safe and kind care for older adults. So, to emphasize the impact each member has on each other through these two theories will aid in learning how to create safe spaces. Another critical human behavior theory this program is based off of is the social model theory, to highlight the systemic barriers, derogatory attitudes, social exclusion that people with disabilities endure, to recognize and understand the negative connotations connected with socially created terms, labels, meanings of physical and mental health features that vulnerable older adults might carry, is to walk in their shoes and to empathize with that stage of life and with what they're going through. That empathy is critical, a critical component to really wanting to soak in the information from these classes. As a caregiver, you can come to these classes and be trained on the topics and leave with skills, or you can come to understand the point of view of the cared for and really retain the information as a foundation to create a healthier lifestyle for both caregiver and older adult, which is really what I'm promoting through a safe and kind care. So the services look like 8 weeks of training and education towards safe and kind caregiving, flexible class scheduling for busy families, Class A and Class B, 2 different times a day with options to mix and match days of the week. For busy families, just 2 classes a week for 8 weeks. There's also easy ways to make up classes as there are many class options available. A support group setting for classroom activities, family counseling through 2 interviews held within the 8 weeks, which is also extremely flexible as they're over Zoom for families who do not have Zoom available. I've included 3 laptops for lending on our budget that caregivers can check out and check back in through a number system. And also it will provide resources as fit for the family, resources for food, a few hours of care, tips and techniques, support groups, help with finance management. I've accrued many resource options from caregivers of the emergency department. There are 2 outcomes I'd like to see achieved from caring for caregivers. Outcome 1, promote awareness for older adult abuse and its common connection to caregiver burnout. Some indicators that this has been achieved would be that caregivers are knowledgeable and aware of signs, symptoms, and risk factors of all types of older adult abuse. Caregivers understand the importance of personal self-care to decrease the conditions that commonly lead to older adult abuse. Another outcome would be develop stable relationships for safe and kind care. Indicators would be improve positive interactions between older adult and caregiver, learn to create positive living spaces for older adult and caregiver. And then to evaluate the effectiveness of the program, the evaluation tools are confidential, qualitative, and quantitative surveys to measure class direction and morale, a pre-screening and a post-screening to measure growth and class efficiency, 2 family interviews to address any concerns, discuss needs, support family connection and inclusion by 2 mental health counselors to create a list of key themes and direction. So I propose that this curriculum is necessary to decrease older adult abuse through an intervention that targets caregiver burnout. I believe that with these trainings and education will bloom healthier living spaces and relationships to foster safe and kind care, alleviating opportunities for abuse and caregiver burnout. Ultimately, these are the steps we need to begin taking when discussing older adult abuse. So thank you so much for listening to my presentation. I look forward to continuing my efforts to advocate for resources for disadvantaged groups and specifically vulnerable older adults. Thanks again.